Hello, my name is Mackenzie Milburn, and I'm a family nurse practitioner student at West Texas A&M. Today I'm going to be doing a suture repair. I have a 28-year-old male who came into the clinic today because he got a laceration from a piece of metal working in his yard. This patient is up to date on his tetanus shot. He said he had to receive one about 2 years ago. I'm going to just demonstrate how I would close his suture. So I'm going to tip this camera down a little bit. So here I've got my sterile field and my sterile gloves. I am first going to wash my hands prior to putting on my sterile gloves and make sure that they're nice and clean. Next, I'm going to assess my wound. So this, of course, wouldn't be in my sterile field, but for the purpose of this video, it is going to have to be. I'm going to measure my laceration. So I've got a 5 centimeter laceration, so I can prepare to do about 10 sutures to repair this laceration. Next, I'm going to apply my sterile gloves. So if they were sterile, it'd be a lot better. So I've got my sterile gloves on. I'm going to next numb the patient's laceration up. So like I said, I've got a 5 centimeter laceration on the arm. With a 5 centimeter laceration on the arm, I'm going to use lidocaine with epinephrine. So I can use up to 7 milligrams per kilogram on this patient's arm. And I'm probably going to do about 5 milliliters worth of lidocaine in this incision. So since his incision is nice and clean, I'm actually going to go on the side of my laceration, and I'm going to do a small injection right there, and then I'm going to move forward with the rest of my laceration, and I'm going to just numb it all the way down. I can't really inject on this suture pad though. So I've got 5 milliliters injected. I'm going to wait about a minute. And then I'm going to take my forceps and I'm going to ask the patient if he can feel anything with me kind of messing with the laceration, and he says that he's good and numb. So like I said, I had previously irrigated the wound. I'm going to clean it again with some betadine, just making sure it's nice and clean for this procedure. I'm going to let that dry. Since I've got a high tension area, the next thing I'm going to use is my 3O Ethylon sutures. These will have to be removed. They will not absorb into the body, so the patient will be instructed on that to return in 14 days to get these sutures removed. So I'm going to open up my suture package. Kind of get this nice and straightened out. Being careful with that needle. I'm going to pick up my needle with my forceps, and we are going to be closing this laceration by primary intention because it's less than 6 hours old, so that means I can suture it up. I'm going to get a good grip on that. And then I'm just going to start on the area closest towards me and move outwards. So I'm going to get a good chunk of the skin and use my forceps to help guide that needle through. And I'm going to pull it all the way through, leaving just a big enough tail so I can tie it. I'm then going to take my hemostats and I'm going to wrap the suture around it twice, grab the tail of it, and pull it through. I'm going to cross my arms while I'm doing this so my suture will lay flat. I've got it nice and flat, and then I'm going to just do it again, but just wrapping it around once around my hemostats, pull it through, and uncross my arms. Wrap it around once, pull it through, and cross my arms so that suture will lay flat. And then again, just one more time through. I do 4 passovers because it makes sure that that suture is nice and tight, but at the same time laying flat against the skin so it doesn't have the possibility of yanking or tugging on anything. I give myself just about a little under of a centimeter of a toe, maybe like a couple millimeters of a toe, So whenever we go to remove them later, we have some things to pull on. And I'm just going to do it all over again. I'm going to go about 5 millimeters up for my next one. I'm going to get a piece of that skin, pull it through, pull it all the way through with my forceps. And then I'm going to guide it around my hemostats twice through that loop, pull it through, and again, just want okay, and then now we're going to cut that tail. So we would do this enough times just to close up that laceration all the way up. Like I said, I have a 5 centimeter lac, so I'm going to be planning to use about 10 sutures all the way down this. After I get the sutures all done, I will again clean the site, make sure that bleeding is controlled. It should be because I'm using lidocaine with epinephrine, so it'll help vasoconstrict that area. And then I'll tell the patient that when they get home, they can take some Tylenol or ibuprofen as needed for pain, but they won't feel the laceration for a good 3 hours after the epinephrine's out of there. I will instruct the patient that they can keep their arm bandaged for the next 48 hours, and then after that, they can leave it open to air for the remainder of their time with the sutures for the next 14 days. I will also educate them to not submerge their sutures in water. If they're going to shower, just let the water gently run off of it, and to wash it with antibacterial soap. A good one that we use is Dawn dish soap, works fine. And then after that, I will just tell them to follow up in the next 14 days to have the sutures removed. Thank you.